Malaria Consortium has gone out to work also closely with the district health department and the local leadership, where the selection of village health teams has been done. And across the 9 districts, we have so far trained close to 7,000 village health team members who are out in the community. They've been equipped with medicine boxes, and they have the medicines and supplies to enable them do their work so that they're able to respond to any caregiver or mother who comes with a child who has malaria, pneumonia, and diarrhea, and they're able to treat this child. Where there are cases that are beyond them, they've also been trained to give pre-referral treatment and send off this child and refer them to the next level. And that is working very well.
It's an approach that we use to tackle the 3 commonest diseases in children who are aged under 5: diarrhea, pneumonia, and malaria. It's integrated because we use community health workers who are trained to manage these 3 diseases. They manage them in terms of making a diagnosis, giving some basic treatment, and referring very sick children to the nearest health facility.
My name is Mrs. Sarah. I'm 22 years. I became a VHT in December 2010.
The VHTs are trained to use a simple job aid, and it's called a sick-child job aid. And this sick-child job aid has steps, and these steps they guide and help the VHTs. And when they follow these steps, they can't go anywhere. So it helps them to remain within the guidelines. Otherwise, if they are thinking through or memorizing, they will make mistakes. And then by following this, it becomes easier for us to know whether someone is performing well or is not performing well.
The more thing which interested me was to study about our community and also to help our people and to help them with the drugs, to get them nearby. And when the drugs are nearby, it saves their time to go up to the nearest health center.
ICCM it's designed for the hard-to-reach populations. And in the areas where we are, in these 9 districts in the Midwestern regions, are hard-to-reach areas. That means the infrastructure is not there or poor, the roads inaccessible, and there are fewer LSA facilities. And in some of the communities, they live near the lake shores, and the places are very geographically impossible to reach. So having a village health team who is within the communities, known by the communities, selected by the communities, a walkable distance from your home, it simplifies everything.
Historically, the assumptions that we made have been that every fever was caused by malaria. And so the disease control approach has been to give every child with a fever an antimalarial. More recently, with the advent of rapid diagnostic tests, we now have the capacity to determine whether a child with a fever actually has malaria. Therefore, the concept of fever being malaria is no longer pertinent. Once we have a diagnosis, we can give appropriate treatment. This then means that the quality of care that we're providing is far higher than we have been able to do before.
Malaria is not there, and cough is not there. So I'm going to treat diarrhea with orals and zinc supplement.
Having a health worker who can be involved in the behavior change process and a health worker who can make a very simple diagnosis, give treatment, and refer severely ill children, we feel is going to be an effective approach to reducing the burden of disease in Uganda and potentially sub-Saharan Africa as well as Asia.